Bismillah ar-Rahman ar-Rahim. My dear students of Ajman University, College of Pharmacy and Health Sciences, Dosage Forms 1 course. I welcome you to our third topic, and that is about tablets. This topic is very important. It will be included in the final exam. It's the longest topic that we will talk about. So you need to pay attention. As we do always with the topics that we discuss, the first thing we talk about اللي هي objectives or the learning outcomes from this topic. Now the first learning outcome is for you to identify and differentiate between different types of tablet dosage forms. This means that tablets are available in different forms. So you need to know the difference and the use or advantage and disadvantage of various types of tablet dosage forms. Isn't differentiate between them, know the advantages and disadvantages of different tablet dosage forms. Additionally, you need to be acquainted and knowledgeable about the different ingredients that are used with tablets. Different ingredients, I'm talking here about the inert ingredients, or what we call them as excipients. So what are these inerts and why do we use them when we prepare compressed tablets? Here we are talking about compressed tablets because they are the main form of tablets available in the market. Now also you need to learn about different coating types that we apply in the coating process to tablets. طبعا these coatings can be functional coatings or just plain coating. So you need to know about the coating process and the types of coating and how we do them. Also, you need, as with every topic, you need to know about the quality standard tests that are applied to tablets. طبعا United States pharmacopoeia requirements are important in this regard. طبعا it's not only the United States pharmacopoeia that is available for this purpose. طبعا we have other pharmacopoeial requirements such as those in European pharmacopoeia, British pharmacopoeia, Japanese pharmacopoeia, Indian pharmacopoeia, there is the international pharmacopoeia. There are different pharmacopoeia and we need to address one of them when we prepare tablets. In these tests, one of them is weight variation test, and the other one is content uniformity test. So you should be able to differentiate between these two tests, and when do you apply weight variation test, when do you apply content uniformity test. Also you need to know about the inspection, the packaging, and the storing of the tablets, يعني the storage conditions for tablets. You remember that capsules needed appropriate storage conditions, otherwise the shells of the capsule will be affected, whether by the dry conditions surrounding the capsules or the moist or high humidity conditions surrounding the capsule. Okay, so we always talk about the learning outcomes of any topic, and then we start with the definition. Tablets are solid dosage form, as the case with capsules and as the case with powders and granules. But as with capsules, we started defining tablets as unit solid dosage form. And you already know why we call it unit. It's because each tablet represents a unit and it also represents each tablet represents a dose of the drug. It's like divided powders between brackets. So we define tablets as unit solid dosage form. طيب طبعا of course it contains the drug and usually with other suitable pharmaceutical excipients. The case with capsules حكينا, in which the drug and other additional ingredients are contained within hard or soft gelatin capsules. Here again the drug is formulated with other pharmaceutical excipients, and the way you prepare it is by usually compression. Isn't primarily tablets are prepared by, what's the answer? Compression. ليش? Why? Is there any other way? What is the other method? Okay, I will answer this. You don't have to do it as a homework, but the other way is molding. يعني عن طريق القالب. نحضر التابلتس, we prepare tablets in molds. إذا في عندنا molds, قوالب. These molds, the tablet will take the shape of the mold. Okay? Okay, some tablets, as you see here in the figure, some tablets are grooved or scored. شو يعني grooved؟ grooved يعني محزز. scored similar term. scored or grooved زي ما انتم شايفين هون في عندنا score. Why do you think we have in some tablets these scores? The reason is to allow them to be broken easily into two parts, as you see the case here. The score here allows two parts to be to result upon breaking. If there are other scores, it allows more parts to be broken or to result from breaking the tablets, depending on how many scores. Normally we have one score, as you see here. That's why some tablets are having scored or grooved surface. Okay, we will talk about the types of tablets, and here we will talk about the compressed. Why? There is another type of tablets اللي هي molded tablets. But because most tablets are produced by compression, that's why we will focus on these types of tablets. Before we talk about these types, we need to talk about tablet formulation. So tablet formulation, in addition to the drug, it contains adjunct. Adjunct يعني something to help formulate the drug, to make the drug suitable, but it is inert. Doesn't give the action. طيب, the first diluent, the first ingredient here, inert ingredient, is the diluent. Now, remember what we talked about in capsule. Now, the most common reason for adding diluent is to increase the bulk, or let's say to increase the quantity that we deal with in the machine. The machine needs to compress the tablet. If the amount of the drug is very small, say 1 milligram, okay, in this case, the tablet machine cannot deal with 1 milligram. Maybe at least it needs 60 or 120 milligram for the tablet machine to be able to deal with the powder or with the granules. So what do? We mix the drug with diluent. طبعا, the diluents, as you have studied in capsules, can also help in improving the flow, but it's not glidant. We don't call diluents as glidants because they are not specifically used to do that. Actually, glidants are material that are able to improve flow in very small quantity. Yani, for example, 1% of the whole formulation using glidant will improve its flow. But when we talk about diluents, we are using it in higher quantities, sometimes even much more than the drug itself. فإذا we are increasing the bulk of the powder, allowing the machine to be able to deal with the formulation. Also, the diluents will improve the properties of the powder in terms of its flow, its compressibility. The other group of ingredients that we may need is the binders or adhesive. And here I want you to remember the topic about powders and granules. If you go back to this topic, you remember when I was talking about granulation, wet granulation, if you remember, I said that we add binder. It's a material that usually dissolves in water, and we use water as a vehicle, and we add this vehicle containing the binder, we add it to the powder mixture in order to wet the mixture and bind the particles together to allow us to form granules. Isn't it allow granulation to happen by sticking the particles together? Isn't the binder will help in gluing or sticking the particles together, allowing granulation. Also, there is additional thing now. After granulation, you will have the compression, and compression stage involves the compression of granules. Granules will be containing the binder. When you do the compression, the presence of the binder will be very important to stick the granules together, forming tablet. Isn't the integrity of the tablet, تماسك التابلت, its strength will also be affected by the presence of binder or adhesives. فإذا the more binder I add, the stronger the tablet will be. فإذا if there is a question asking you what will be the job of the binders in a tablet formulation, we will say 1, to allow granulation to happen, 2, to maintain tablet integrity and mechanical strength. Type number 3 is the disintegrant or disintegrating agent, and we talked about this in capsules where we will need to use super disintegrants in case of capsule. But for tablet, do we need to use super disintegrants? Otherwise, it will not work? No. In this case, we can use either normal disintegrants that have been known since very long time. It will work. And also we can use the super disintegrants, if you remember, like cross-carmylose, cross-povidone, sodium starch glycolate. These super disintegrants can still be used in tablets to give fast disintegration. What do you mean by disintegration? Meaning it's the breakup of tablets. So once the tablet is swallowed with maybe a glass of water and it reaches the gut, the gastric juice and the fluid in the gut will allow the disintegrating agent to start working and breaking up the tablets. طبعا, if you remember, the process or the mechanism by which most disintegrants work is by swelling or wicking. Additionally, we need to add anti-adherents, glidants, lubricants. Collectively, they are referred to as lubricating agent. Lubricating agents can be anti-adherent, glidant, and or lubricants. These material will allow the tablets to be produced without weight variation and without sticking to the tableting machine. Now here I want you to do something. I want you to go back to capsules because I explained to you what do we mean by lubricants. And I talked about the three types of lubricants اللي هم anti-adherents, glidants, and lubricants. Now this will be a homework that you should know the function of each one. شو يعني anti-adherent, glidant, lubricant, and example of each. If you go to your eMoodle, you will find the resource, and I will show you the answer here. Okay, if you go to your resource, what do you mean by glidant? This is the definition of glidant. And here we have examples: talc, colloidal silica. Colloidal silica, low silicon dioxide that you studied with capsules. It can be used in very small quantity. شوفوا قديش 0.2%. It's not a diluent. Diluent are used in very large or relatively large proportion. We have also magnesium stearate. Lubricant, this is the function, and example of lubricant is here اللي هو stearic acid or stearic acid salts. في عندنا magnesium stearate. Regarding the anti-adherent, this is the definition, what the function of anti-adherent is, and we have example magnesium stearate, talc, starch. And this is a homework for you to do. Now to go back, in addition to this material, we have also optional materials such as colorants. Not every tablet needs to be colored, and flavorants. Not every tablet needs to be flavored. Usually flavored and sweetened tablets, they are supposed to be administered in the oral cavity. Okay, oral cavity يعني في التم. For example, زي lozenges, زي chewable tablets, they need to be chewed or sucked inside the oral cavity. That's why you will need sweetening and flavoring agents. Okay, now we will talk about first type of tablets اللي هي we call them multiply compressed tablets. Multiply compressed tablet. Why we say multiply? It means more than one compression, so we say multiply. Now there are two kinds of multiply compressed tablets. One is the multiple layer tablet. The other one is tablet within tablet. Then let's look at both. What do you see here? You see here multiple layer tablets. This is a layer and this is another layer. Tablet within tablet, you see here there is a tablet and outside there is a tablet. So we call it tablet within tablet. The inner tablet we refer to it as core. إذن هذا core. طب the outer tablet, what do we refer to it as? We refer to it as shell. طيب, the question is, and it's also a homework, is what are the reasons for preparing such tablets? Why do we need to prepare such tablets? طبعا the answer you will find it in the following resource which I uploaded to eMoodle. Tablet types. If you go multiple compressed tablets, and here is the reason. Each layer may contain different medicinal agents separated for reason of chemical or physical incompatibility, staged drug release, or simply the unique appearance of layer tablets. يعني ايش? What does it mean? If there is chemical interaction between two drugs or two materials, then I need to separate them rather than mix them together. So I'll put one in a layer and the other one in another layer. Also, this is the same in case of physical incompatibility. whether chemical or physical. Now, staged drug release means when I want one layer to release the drug maybe quickly, let's say, the other layer to release the drug more slowly, to have extended release product, for example. Or just the appearance. Some tablets are produced as layer tablets, multiple layer tablets, and the reason is we want the tablet to appear as ish in different colors. So how can I make the tablet, one half of the tablet a color and the other one is another color? I can do that by preparing multiple layer tablets, and I will show you that. Okay, so let's go back and talk about the details of how we can produce tablet within tablet or layer tablet. First, we're gonna explain to you by showing you a video how layered tablets can be produced. Okay, I want you to look at this video. Here, what you see here, okay, we call these things the upper punch stations. يعني هذا station carrying an upper punch. هذا الupper punch. اللي شايفينه here, what you see here, اللي هي الداي. شايفين الداي? This is the die, القالب يعني, where tablet gets compressed. وهون في عندنا الداي cavity, يعني الفتحة اللي في الداي. What you will see here in this side, you will see a hopper. And if you remember, the hopper is like a container or vessel holding the formulation. So this hopper will fill the cavities, the die cavities اللي موجودة هون. And these upper punches, طبعا في هناك كمان lower punches, في upper وفي lower. And the lower and the upper, they will compress the formulation inside the die cavity. So the upper punch will descend, compressing the powder formulation which is inside the cavity. طبعا هتسوي compression. Now more space will be left inside the cavity. Then this die and its cavity and the corresponding punches, they will rotate. يعني كل هذا, they will rotate, they will go to the next hopper. Then we have, how many hoppers we will have? We will have 2 hoppers. Each hopper will be responsible for a layer formulation. فبالتالي I will have 2 layers. I can have also 3 layers. If I want to produce 3 layers, in this case I will need 3 hoppers. Okay? Each hopper will contain its own formulation. طبعا الهوبر, the end of the hopper that feeds the die cavity, we call it hopper shoe. نحكي قدم الهوبر. It feeds the cavities. Okay, so let's talk about this one. This is the first hopper shoe. It will feed the die cavity, and then it will be compressed at this stage as you see it here. بعدين الupper punch will go up. All upper punches will go up. Then the die cavities will rotate to the next hopper. The next hopper, it will be filled again, and then بعد الفilling again it will be compressed again. فبالتالي how many compression here we will have? We will have 2 compression. This 2 compression will result in 2 layer tablets. Okay, and usually each layer, this is the usual way, each layer will be of different color. فإذا the tablet that you will see will be having 2 different colors when it's produced. So I want you to pay attention to what I explained to you already and to the video that you will see, because it will show you the whole process which I discussed. here you will see that after the tablets are produced, what will happen? The lower punches that you don't see now here, the lower punches, but the lower punches after that will be lowered to allow for the filling again. يعني راح يصير the same cycle will be repeated. The lower punch will descend, راح ينزل شوي, it will descend little bit to allow for the formulation to be filled from the first hopper. Then compression will happen. بعد الcompression ايش بصير? It will be filled from the second hopper, and then this is the ejection part. في ejection part, if you see here, the upper punch goes up, it goes up, with lower punch goes also up to locate the tablet at the surface. When it reaches this obstacle here, the tablets get removed, okay? Okay, so how do they prepare tablet within tablet? I will show you a video of that. But first, initially, they need to prepare the core tablet. This one needs to be prepared separately, okay, by another machine. First, prepare the core tablet. Now you need to put this core tablet inside the shell. Now, how this is done? Let's look at the following video and I will explain it to you. Okay, now here, what do you see here? Here you see the core tablets in this one. Now the core tablets will be allowed to get through this pipe here. شايفين هذا البايب? This pipe allow one by one from this core tablet to be located in holes. في عندنا هنا rotating plate containing holes. Each core tablet will get to the hole in this rotating plate. Okay, watch here. The core tablets are getting placed in the holes. The plate contain holes. It will be placed في each hole. Each hole will have one core tablet. Now this core tablet, this rotating plate, will take the core tablet into partially filled. طلعوا هون. These are the upper punches. هنا في عندنا lower punches, and this is the die, وفي عندنا die cavity. Now these core tablets will be transferred لوين؟ لا die cavity containing already partially filled formulation من الshell. Okay, and it will not be completely filled, it will be partially filled. And the core tablet will be placed exactly in the center of the die cavity. Okay? So when it's placed in the center of the die cavity, شو بكون تحته? What will be beneath the core tablet when it's placed in the center of die cavity? اللي هو part of the formulation from the shell tablet. Okay? طيب, after that, the upper punch will come down, will descend. The upper punches will descend. وشو بصير عندنا pressure, compression. فبصير عندنا partial compression. فشو بصير عندنا like half tablet, زي كأنه half tablet. A shell from beneath the core, and then the core and this together they are compressed. Now what happens after that? The die cavity, the cavities are rotating, so they will go to the next hopper. إذن في عندنا how many hopper here? We have two hoppers. One to fill part of the shell formulation, and the other hopper is to fill the other part of the shell tablet formulation. Then you will have compression. Okay? Watch that. Okay, so now we learned about multiple or multiply compressed tablets. Now we will talk about sugar-coated tablets. Sugar-coated tablets can be colored or uncolored. The sugar-coated tablets, the coat itself is water-soluble, so there is no long retardation of the dissolution of the tablets. طبعا there will be some delay, لكن it will be soluble very quickly, will not take very long time to dissolve, so this will allow the drug to be released. Why we are coating the tablet with sugar? First, the sugar coating can protect the drug from the environment. Although I have to say that the environment itself can affect the sugar coat. And sugar coat, as I said, is water soluble. فمعناته if the environment contain high humidity, it will start to dissolve the sugar coat. Another advantage of using sugar coating اللي هي it can hide objectionable taste and odor. Sugar coating surrounding the tablet or the drug the drug in the tablet, okay, can protect it from objectionable taste. يعني the patient who takes the sugar coated tablets will not feel the taste or the odor of the drug. Odor يعني smell. Now, additionally, sugar coated tablets, as you see here, they are very well known to be shiny. The reason for that, they add wax. يعني after they do the sugar coating, they wax the tablets. Wax like when you do polishing. For example, shoe polishing, بصير عندنا ايش؟ shiny. It will be shiny. The appearance will be looking good. Also, it allows the printing of, for example, drug name, logo, or the trade name on the tablet. Now, what is the problem with that? The problem will be a disadvantage. One, it takes long time. When we later on in part 2, we will talk about about coating in general, including sugar coating, and you will see that so much time and efforts are involved, and it needs expertise في البروسيس, يعني someone specialized. طيب إذا it takes long time, many steps, needs expertise, and another advantage اللي هي increase in the size. معروف, it's well known that sugar coating can increase the size of the tablet considerably. طب شو بيأثر هذا لما يصير increase the size وبالتالي الويت؟ بصير I need larger package and the shipping cost will be higher. Not only that, but even swallowing a larger tablet might become difficult for the patient. The weight increase because of this sugar coat can be about 50% of the weight. يعني 50% of the tablet weight will be عبارة عن sugar coat. It's like you are doubling the weight of the tablet. فإذا it includes many steps. It needs time, it needs expertise, the size increases, and so the shipping cost of the tablets. In comparing to sugar coating, في عندنا الفيلم coated tablets. Film. Now, the film is just like a skin to the tablet. Okay? You know how the skin holds our body. So the film coating عبارة عن polymer, and maybe here you remember the enteric coating. Actually, the enteric coating is a type of film coated tablets. But the polymer might not be enteric, it might be something else. For example, hydroxypropyl methyl cellulose, which is water soluble. It doesn't affect the dissolution of the drug significantly. We therefore it doesn't have a function regarding the release of the drug. فإذا الفيلم coating is thin layer. If you compare this to sugar coating, it's not thin, it's thick actually coating. It's thin layer of polymer that forms a skin-like film around the tablet. طيب, usually it's colored, فبالتالي the tablets usually will have a color because of the film coating that we are applying. وبالتالي if you compare it to sugar coating فهي less bulky. Not only that, but unlike the sugar coating, one of its disadvantage actually is that it's not stable. It can have cracks. بينما الفيلم coating usually it's more durable in the sense that the film itself holds the tablet tight. كأنه it's like protective. Okay, like our skin. It holds the tablet and it's flexible. فبالتالي any like shock to the tablet will not cause the tablet to break easily. إذن it's more durable, it's less bulky, and also it's less time consuming. يعني if you compare here, it takes long time, maybe one full day. But if you compare it to film coat, if you look at the film coating, maybe it take 1 hour and a half, where you are spraying the polymer solution or colloidal suspension of polymer. You spray it into the tablet, it gets the drops spread around the tablets, and then you dry it. Okay, and that's how you get the film. Another type of tablets اللي هي gelatin coated tablets. Example عليها اللي هو الجل كاب. Look at the tablet here. This is a normal tablet. We call it caplet. Why we call it caplet? Because the shape is like a capsule. فبنحكي له cap because the shape is like a capsule, and you know when you have this shape, it allows the swallowing to be easier. لأن it is a tablet prepared by compression. Now, what you see here is a trade name for paracetamol or acetaminophen, اللي هو Tylenol. Now, this one or this tablet can be enrobed, يعني يغلف بجيلاتين, as you see it here and also here. Now, what you see here is what we call gel cap. Okay, it resembles the hard gelatin capsules in shape and look, but actually this is an enrobed gelatin, or gelatin that enrobes the caplet. Okay, as you see it here, and there is no spaces between brackets, body and the cap. Actually, this is one piece. It's like hermetically sealed, similar to the soft gelatin capsule, but looking like hard gelatin capsule as a lock. Now, if you look here carefully, what's the advantage of having this gel cap? One, compare it to capsule. If I want to put the same quantity in hard gelatin capsules, what will you be filling في الهارد جيلاتين capsules? الكاب ولا البادي? You'll be filling البادي, and the compression is not hard, بيكون soft compression. فبالتالي the cap will be empty, يعني there is more space في الكبسول. That's why the size of gelatin coated tablets is smaller, 1/3 smaller than a capsule. ليش حكينا why? Because in the capsule we are filling the bodies, but here the whole thing is the drug, and the drug is occupying all the volume inside the gelatin coat. طيب, this is one. Second thing, because it's smaller, it facilitates swallowing, يعني compared to hard gelatin capsule. Because it's smaller, swallowing will be easier, and that will be aided with gelatin cause slipperiness. يعني because of gelatin coat, the gel cap or gelatin coated tablets will be slippery. يعني it will slip in the throat and into the stomach. Another advantage compared to hard gelatin capsule, it's tamper evident. Now you cannot come here and say, okay, I want to remove the body from the cap. No, you cannot do this because all of it is one piece, hermetically sealed. Okay? That's why طبعا أكيد it's more costly than tablets and than making a capsule, because you need special machine for that. طيب, enteric coated tablets, this is a type, as I said previously, of film. صح؟ film coated tablet. بس ايش نوعها؟ الفيلم اللي هو enteric coated. So in this case, what polymer will you use? You are going to use a polymer. صح? But what polymer will you use? If you remember, you need to use enteric polymer. Enteric polymer, if you remember, عندنا cellulose acetate phthalate وعندنا polyvinyl acetate phthalate اللي هو PVAP. You use this to coat the tablets. Now the question is, why you need to coat the tablets and make it enteric coating? طبعا the answer is homework. I will tell you what is the answer. The answer is because in some cases the drug irritates the stomach, زي الأسبرين. Many people, especially with heart condition, they take aspirin. And aspirin, one of the problem of aspirin that it irritates stomach. So instead of aspirin being released في السtomach, I want it to be released in the intestine. Type, this is one. Is a drug irritating the stomach. Number two, the stomach, with pH of the stomach is degrading the drug. يعني the pH condition of the stomach will destroy or degrade the drug. So I want to protect the drug in the stomach. So I need enteric coating. طيب, a third reason is I want most of drug release to happen في الintestine, because it's very well known that intestine absorption is much better than stomach. So if the release of the drug starts in the stomach, you will end up with slow absorption of the drug. So you want all of the drug to reach the intestine so that the absorption can proceed fast. طيب, let's look at the answer here. Enteric coating. The answer, enteric coatings are employed when the drug substance is destroyed by gastric acid or is particularly irritating to the gastric mucosa, or when bypass of the stomach substantially enhances drug absorption. Okay, let's go back and learn about the other type of tablet اللي هو buccal or sublingual tablets. These tablets are usually flat or oval in shape. Okay, flat, you know what do you mean by flat. Oval in shape, طبعا flat يعني مش curved, يعني بعكس curved. Flat يعني curved يعني بيكون التابلت something like that. This is curved tablet. Let me draw it for you. This is curved tablet. This is flat tablet. Okay, so it's flat oval tablet. Oval شو يعني بتكون بهذا الشكل كشكل, not كsurface. The surface, as I said, is flat. To be flat, but the shape is oval. يعني هون بيكون little curved to be like an oval. طيب, anyway, these tablets are supposed to dissolve either in the buccal pouch. شو يعني منطقة البوكال؟ اللي هي الوجنة اللي هي عند الخد بس من جوا الماوث. Okay, it's from the oral cavity but at the side. Or beneath the tongue اللي هي sublingual tablet. إذا في عندنا نوعين, two types of administration اللي هي البوكال والsublingual. شوفوا هون, this is buccal and this is sublingual. طيب, if it is buccal, then the tablets are usually hard and it's allowed to dissolve slowly so that absorption from the buccal area can sustain or can continue for a longer period of time. If it is sublingual, then the tablets are intentionally made soft to dissolve quickly, promptly, to give rapid effect. If I want rapid effect, I will not use the tablet في الbuccal area لأن الbuccal area absorption is slower compared to sublingual. فبالتالي if I want something very fast زي النيتروغليسيرين, this is a drug for angina pectoris اللي هو الخناق الصدري لما بيكون عنده الواحد heart condition وما في enough oxygen, ما في enough blood going to the heart, you feel like compression in your chest. الخناق الصدري من زي المخنوق. In this case you take sublingual tablets, although it's not used to prevent if you have angina pectoris, it's not like you take the nitroglycerin to get rid of that. Usually you take it to prevent angina pectoris from happening. In this case you want the absorption to be fast. In case of buccal tablets, you want to use a drug that you want its absorption to last for a longer time. For example, in case of pain, if someone has pain, and you know most pain conditions are not like just for a few seconds or a few minutes, it's usually continuous. So in this case you want the drug to be absorbed over a longer period of time. That's why when you use buccal tablets. The thing is, طبعا, to administer a drug in the buccal cavity might not be convenient, especially when we are talking about buccal tablets where you need to place the drug maybe for 4 hours. That's a very long time. So what are the benefits from having buccal or sublingual tablets? The benefit is, if you have a drug that can be destroyed by gastric juice, اللي هي by the stomach, or the drug undergo first pass metabolism. يعني if I take the drug orally, it goes to the stomach and intestine, they get absorbed, the drug get absorbed, and then it goes to the liver, and liver might remove a lot of the drug before it gets into the systemic circulation. You understand? يعني we call that first pass metabolism. So if the liver will remove most of the drug, then the drug will not be effective orally. So what do I do to bypass the liver? I can administer it as buccal or sublingual tablet. In this case, the drug goes directly into the systemic circulation. مش systematic, systemic circulation. So these are the benefits. Here you see the fentanyl buccal tablets, and these are opioid analgesic, مسكن يعني. And here you see nitroglycerin, which is sublingual, that is used to prevent angina pectoris from happening. Okay, the other type of tablets اللي هو lozenges or troches. Now lozenges, maybe you are familiar with it. It's like this one, strepsils, which are available in supermarket, in pharmacies, etc. They are disc shaped, يعني circular, usually large, they contain the medicinal agent in a flavoring and sweetening base. يعني بيكون في flavor مع sugar base, candy or sugar base. Lozenges can be made by molding. إذا بتتذكروا, if you remember, المولدing is the secondary way for preparing tablets. يعني secondary, I mean it's most tablets are prepared by compression. Now lozenges can be prepared by compression or by molding. Usually if it is prepared by compression, we call it troche. Okay, يعني troche is usually applied to the compressed lozenges. Lozenges معناته it's molding, but it can be also compressed. When lozenges are compressed, we call it ايش؟ troches. طيب, the drugs that are in lozenges, they are usually for local effect. يعني for example, when you have sore throat or you have infection in the throat, you use lozenges because it contains antiseptic medication. It can also contain local anesthetic medication. Although for some lozenges it may contain a drug for systemic absorption. Say for example, let's say vitamin C, etc. You suck the lozenges into your stomach and then it gets absorbed. Chewable tablets, from the name chewable يعني you chew it في المouth. معناته, as the same case with lozenges, it has to be sweet and usually flavor. So anything you keep in the mouth, زي حتى اللي هو sublingual والbuccal, usually it needs to be of good taste. So the same thing with chewable tablets. It contains a medication that you are supposed to chew or allow it to dissolve in the mouth. يعني it's like sucking. Like for example, كيف lozenges, you suck it, you don't break it, you don't chew it. حتى chewable tablets, you might want to suck it and allow the drug to dissolve in the mouth. Usually the base is creamy, flavored, and the sweetening agent used usually is mannitol. Why they use mannitol? Why it's commonly used in chewable tablets? The reason for that is mannitol, when dissolves, it gives a cooling sensation. It makes the surrounding cooler. يعني في عندنا material when dissolves make the surrounding warmer or hotter. وفي عندنا some material, few materials the opposite. منهم one of them اللي هو المانيتول, which is a sweetening agent. When this dissolve in the mouth by chewing and by sucking or allowing it to dissolve, it gives a cooling sensation. That's why it's commonly used for chewable tablet as a sweetening agent. طبعا, because chewable tablets are usually large, the same as in the case of strepsils, you cannot swallow it, but what you can do, you can chew it, as I said, and because you can chew it, it's suitable for children and adults who have difficulty to swallow other solid dosage form. The other type of tablets اللي هو effervescent tablets. Effervescent tablets. We already discussed about effervescent granules, and you prepared that in the lab. And if you remember, the main ingredients of effervescent granules اللي هم ايش؟ citric acid, tartaric acid, sodium bicarbonate. Now, if you don't want to use granules, then you can use tablets. يعني first prepare the effervescent granules, then compress the granules to make tablets, and you will have effervescent tablets. Do you need to add disintegrating agent in this case? No need for disintegrating agent, because The bubble action that results from the reaction of acid and the base and the release of CO2 will assist in breaking up the tablet and therefore enhancing the dissolution of the drug. Immediate release tablets. Now when we say immediate release tablets, we are talking here about the بين قوسين between brackets the conventional tablets, the normal tablets, the tablet that does not have special limiting, for example, special coating to limit the dissolution of the drug. It's a normal one, like many drug products. يعني البانادول is an example of them. So there is no special rate controlling feature في الtablet. So they readily disintegrate and dissolve in the stomach. Now I want you to compare what I said with another type of tablet اللي هو ايش؟ Instantly يعني quickly, very fast, super fast, instantly disintegrating or dissolving tablet, or also we call them rapidly dissolving tablets اللي هي RDTS. Is it different from immediate? Yes, it's very different. One, this instantly disintegrating or dissolving tablets, they are much faster in dissolving and disintegrating, much faster, superpower. Number two, the instantly disintegrating or dissolving tablets, they are orodispersible tablets. Yani, you do not swallow them intact like the immediate release tablets. No. You put them in your tongue and they will disintegrate and dissolve while in the or on the tongue. They absorb the saliva and they dissolve very quickly. That's why they refer to them as orodispersible tablets. And this dissolving and disintegrating happens very quickly, maybe in about 10 seconds, but not exceeding 1 minute. That's why they are suitable for children and elderly who have difficulty in swallowing tablets. طيب, there is a big difference between instantly disintegrating or dissolving tablets with immediate release tablets. طيب, how can we produce such tablets that dissolve and disintegrate very quickly? How can we produce them? Well, there are several methods. One of them is through lyophilization, and the other way is through soft direct compression along with adding super disintegrants and small quantity of effervescent material. طيب, let me explain to you each one. Lyophilization is another term for freeze drying. Freeze drying is a method by which your preparation is frozen and using the right equipment, the freeze dryer, you'll be able to remove the liquid from the solution or suspension. You'll be able to remove that, leaving what? Leaving something like a plug. This plug is so porous, يعني في spaces, a lot of spaces, and hygroscopic. So once you put it in the mouth, it will absorb the saliva very quickly, dissolving the material. Okay, you got it? إذن, freeze your formulation. First, prepare it in liquid, freeze it, okay, and then freeze dry it, يعني dry it while it's frozen, okay, and that's why they refer to it as sublimation. شو sublimation؟ اللي هي converting from liquid, from solid, because you freeze your material, okay, and you remove the liquid. So the solid goes to vapor directly. That's why they call it sublimation, from solid to vapor. فإذا you remove the liquid by a process of freeze drying. The property of the material, as I said, ايش هي very porous, very hygroscopic. So once you put the tablet in the mouth شو بصير عندنا؟ بصير عندنا absorption of saliva أو الليكويد الموجود في الأورال cavity followed by dissolving the formulation very quickly. طيب soft direct compression. شوفوا there is soft وفي عندنا direct compression. Let me tell you first about direct compression. When you want to produce the tablets, you can produce it by one of two ways, either direct compression or indirect compression. يعني suppose I ask you make tablets by compression, you will tell me okay, I will either use direct compression or indirect. Indirect means that first you need to prepare granules and then compress the granules, and this is a common way. Direct means that you take your formulation and you compress them directly without producing granules first. Now it's very well known that direct compression will result in tablets that dissolve quickly. Okay? فإذا that's why we are using the direct compression approach. Now soft, what do you mean by soft? Soft means that you do not apply the normal compression force. You apply a soft force. يعني the compression, the pressure you apply to make the tablet is low. فبالتالي the tablet will break easily. في lyophilization also the tablet will break easily. Here it will break easily. That's why I need to be careful. صح ولا لا? But I need that so that it can dissolve and disintegrate very quickly in the tongue. طيب, in addition to applying direct compression or soft, I need to use super disintegrants so that it can disintegrate very quickly in the mouth, and along with little amount of effervescent materials اللي هو we know اللي هو sodium bicarbonate or citric acid. Okay, in order for it to absorb moisture or humidity from the oral cavity or saliva from the oral cavity and then disintegrate very quickly and allowing the drug to dissolve. Is that clear? طيب, the question is why excipients يعني other than drug that I use must be water soluble. طبعا the reason is when I put the tablet on the tongue, I don't want anything to prevent water from getting inside, saliva from getting inside. So everything must be ايش? Water soluble. طبعا what about the drug? Now the drug might not be water soluble, but anything else needs to be ايش? Water soluble, so that it doesn't prevent the drug, the saliva or the moist from getting inside. That is the answer for why. طيب, now another thing, we need to put the tablets in bubble type packaging like what you see here. Let me see if I have another photo. Okay, this is like bubble packaging. Also the box itself, the box نفسه can contain bubble packaging. You know that when you don't want to break an item, you wrap it with a bubble package. صح ولا لا؟ اللي فيه اللي هو الكيس اللي فيه البابلز كمان. And all of this is to prevent ايش؟ To prevent the tablet from breaking. Also, when you want to take the tablet from inside, like in this case, you see this photo, you want to take the tablet. What is your usual way to take the tablet from the bubble package? Usually you press on the tablet and the tablet will tear the back of the package, صح? Can you do this with instantly disintegrating or dissolving tablet? No, you cannot. Why you cannot? The reason, if you do a pressure on the tablet, what will happen to the tablet? It will break. صح ولا لا? Why it will break? Because we intentionally make it soft. And why we intentionally make it soft? Because we want it to dissolve rapidly في المouth. Look at this one. This is oral dispersible tablets of olanzapine اللي هو it's used في schizophrenia conditions. طيب فإذا now we know about the package and why we cannot press the tablet. حكينا ايش؟ Because it will break if we press the tablet to remove it from the package. طب instead what do? We peel the backing of the package. بنسوي له peeling للباكينج بهاي الطريقة. See, we remove the cover from here. ما بنسوي, we do not press on the tablet. فإذا أجاكم, if you have a patient coming and he's asking for an oral dispersible tablet, you have to counsel this patient and tell him how to remove the tablet. Extended release tablets. شو هاي extended release tablets? What is it? Here the tablet or the drug release will be happening over longer period of time than usual. يعني I am applying feature to the tablet, سواء coating or something else. And I am applying a feature to the tablets that allow the medication to be released over extended period of time. That's why sometimes it's referred to as sustained release tablets, sometimes it's referred to as controlled release tablets. Now some scientists, they say using controlled release tablets to describe extended release tablet is wrong. Why these scientists, they say it's wrong to refer to extended release tablets as controlled release? They say the reason for this is all tablets that we produce are controlled release. يعني you will not produce any tablet unless you know how the release of the drug will be. فإذا you are controlling the release of the drug by all tablets. That's why they say it's wrong just to say it's controlled release for extended release. All tablets are controlled release. طيب هل الانتريك كوتينج الانتريك coating, هل الانتريك coating is extended release? انتريك هل هي extended release? The answer is no. إذن الانتريك coating is not extended release. Enteric coating is classified as delayed release. Delayed release. إذن الانتريك coating شو تساوي؟ It's delayed release tablet. And it's not an extended release. It's delayed. ليش delayed? Because I do not allow the drug to be released immediately in the stomach, but I design it or I enteric coat it so that it gets released when? في الintestine. فهي delayed. I'm delaying that. Okay? طبعا here you have an example of glipizide extended release tablets تستخدم في type 2 diabetic patients. طيب the last type of tablets اللي هي ايش؟ vaginal tablets. طبعا from the name it's to be inserted into vagina. Usually when we say vaginal tablets we mean that it is prepared by compression. يعني مش suppository مش pessary. It's a tablet, vaginal tablet prepared by compression, and the shape is usually a bullet shape. As you see here, it's like a bullet, and usually accompanied by a plastic applicator. So this vaginal tablet is inserted or fitted inside the applicator, and then it's inserted when inside the vaginal area. But for what purpose you will need such tablets? طبعا you will use usually or in most cases it's for bacterial infection زي ما انتم شايفين here نستاتين مثلا, or antifungal, يعني it's used for as antibacterial or antifungal agents. إذن the drug that we use here are either antifungal or antibacterial agent. Antibacterial agent, antibacterial زي ايش البكتيريا اللي هو هيموفايلس فاجيناليس, وفي عندنا antifungal agents against the Candida albicans. طبعا these tablets are not prescribed for unmarried ladies or girls. They are for already married women. They can use such tablets, vaginal tablets. Okay, after talking about the different types of compressed tablets, now we want to talk about their manufacture. But remember, I said tablet by compression can be prepared by direct way or indirect way. إذن في عنا الcompression can happen by direct or indirect. طب شو الفرق? What is the difference? The direct is that your mixture of drug and other excipients are directly compressed. Okay, هل في هناك عملية drying? No, because I'm not doing any wetting or any granulation, and that's why we call it direct. طيب indirect can happen by wet granulation or dry granulation. إذن here it's indirect. Why it's indirect? Because first we need to do granulation, whether it's wet or dry. Because we need to do granulation, we refer to it as indirect. يعني إذن first we need to prepare granules, then we can compress them. طيب, so this is one way of classification. So we can classify the way to produce tablet by compression as direct or indirect. Also, we can classify the way to produce tablets as dry and wet method. Then this is another way of classification, اللي هي dry method or wet method. If I classify it as dry method and wet method, فالdry method راح يكون جواته direct compression and dry granulation. لأنه dry granulation I'm not using any liquid. أما الwet method فهي indirect through wet granulation. You got it? يعني I can say here dry methods و wet methods. في الwet راح يكون عندي الإيش؟ wet granulation. طب في الدراي شو بكون عندي؟ اللي هو direct compression وهذا one. the second اللي هو ايش؟ اللي هو dry granulation. Okay, this is another way of classification. So let's look at the different process and discuss them. الwet granulation اللي هو indirect method. See, first I have to control the size of the drug and the excipients. Number one. Number two will be mixing. So I have to prepare a uniform mixture. Number three, I need to add the binder solution. I need to add the adhesive liquid. So here, while I am mixing the powder, I need to add the liquid and allow the liquid to mix well with the with the mixture of the drug and the other adjuvants. Other adjuvants include ايش؟ disintegrating agent, diluent. These are the most important two adjuvants that are added here. Now, sometimes I do not add the whole quantity of the disintegrating agent at this step. I may add only half of the disintegrating agent here, and the other half I add it to this step here. Later we will see. So I either add all of the disintegrating agent here, or maybe better, add half here and half later. طيب, then you add the binder solution or adhesive solution, and you know why we need to add the binder solution. This is to allow the particles to stick to each other, and you will have wet powder here or damp powder here. Then it's better, before you dry the damp powder, it's better that you granulate your wet mass to make them or to cut them into small pieces. Why? Later on you are going to dry them, right? So if they are smaller in size, the drying will be better and more uniform. فإذا, because of I want the drying to be better, usually I break them to smaller pieces in this step. How can I do that? Well, later we will see. After you dry your wet mass, this step is very important because you need to control the granule size. So you will force your dried granules, you will force them through screen or sieve that have openings less than the ones that you use here. Here the granules, you need smaller granules, so you will force your dry mass through the dry granules through the screen here that have openings that are smaller than the sieve that you use here. طيب, after that you need to add lubricants. Lubricants include واحد, as I said previously, glidants, lubricants, anti-adherents. Some material can function well in the three categories like magnesium stearate. Sometimes we may need to add also a glidant. طبعا, before you add the lubricant, lubricants are usually added the last step just before compression. You will add the disintegrating agent. If you didn't add all of them here, then you will add half of them here. And the last step is usually lubricant. And lubricants are usually, especially when I'm talking about magnesium stearate, is usually added the last step, and usually I do not want to have uniform mixture like other ingredients. In case of lubricants, magnesium stearate, which is very hydrophobic, I do not want it to get mixed very, very well in the mixture. This is maybe the only ingredient that I do not intentionally mix it very well. And the reason is, if I mix it very well, magnesium stearate will start positioning itself between particles. And when it does that, and I want to do compression, it will prevent granules and particles from sticking to each other. لأنه هو أصلا lubricant, هو it doesn't allow sticking to happen. That's why I only need the lubricant to be in the outside of the formulation. I do not need the lubricant to be inside. If it is inside, then it will prevent forming the tablet, prevent the tablet from having good strength, good mechanical strength. That's why I'm not really concerned with getting a uniform mixture in this case. فإذا we add lubricant the last thing in the process. طيب, في dry granulation, and we already discussed these two processes maybe in powders and granules. We discussed that. For dry granulation, first you control the size of the drug and the other excipients. Then you mix them, you blend them. Here again, you might add all of the disintegrating agent or half of it. Okay? In any way, after you do the mixing with the diluent and the disintegrating agent, you take it to a roller compactor, roller compaction machine. Okay? فإن this machine طبعا either roller compaction machine or you will use a slugging machine. So in this machine you will compress your powder. إذا كانت roller compaction machine في بيطلع عنا هين إيش compacted sheets. إذا عنا slugging بيطلع عنا slugs like a tablet. Okay. طيب, what caused them to stick to each other? ليش الضغط, why the compression here in this step will make the particles stick to each other? Is there any reason for this? Well, there is a reason. The reason is the van der Waals forces, which you probably studied in Physical Pharmacy 1. When you bring particles together, the closer you bring them together, the more forces of attraction they will have to each other. So by compression in this step, I can enlarge the powder that I have into big pieces, whether slugs or compacted sheets, but then I need to crush them, and then I need to control the size of the granules through sieving. And then, as I said, if you did not add the whole disintegrating agent here, then you can add part of it in this step. And the last thing is that you add lubricant such as magnesium stearate, and eventually, or the last step is to compress them into tablets. Okay, this is the dry granulation. طبعا, is there any drying? ما في عنا عملية drying because I'm not adding any liquid. Is there any wetting process? لا. فإذا you have maybe less time here because you do not need to do drying and wetting in this process. Okay, the last step is direct compression. And as you see here, there are much fewer steps than the indirect compression, whether it's by wet granulation or dry granulation. First, you need to make sure that the particle size of the drug and other adjuvant is according to your requirement. Then you blend them. طبعا, adjuvants include usually directly compressible vehicle. This is a diluent that will help or will aid the formulation to be directly compressed. And this is actually a reason why we usually prefer granulation. We prefer granulation because granules are readily compressed because you will have a binder in the formulation. Here you don't have a binder. Actually, the binder needs to be usually because the drug, most drugs are not directly compressible. That's why the diluent that we choose is a diluent that is able to make the formulation bind together upon compression. That's why we use directly compressible vehicle. So we mix the directly compressible diluent or vehicle along with all of the disintegrating agent and lubricant at the end. We mix them and then we take them for compression to get tablet. So as simple as that. Now, if someone asks, why don't we just go for direct compression? One reason is, حكينا, not all drugs are directly compressed. Actually, few of them are. And that's why we need a special diluent to make the formulation directly compressible. A second reason, probably because of flow. Now, granules are bigger in size and they flow very well. And in industrial scale, we need good flowing formulation. Granules are bigger. If we don't make granules, the flow will be most probably a problem. Okay, that's why we prefer the granulation way, the indirect way. Here I forgot to say that DiTAB is the trade name for dibasic calcium phosphate, اللي هو inorganic diluent that we talked about في الكبسول formulation. Okay, most agents, most drugs needs excipients, as we already talked about before. This includes the binders, disintegrants, diluents, lubricant to get the desired characteristics. Granulation, as I said just a little while ago, will allow the flow to be better compared to the case when we have direct compression. Granulation, as I said, has better compressibility characteristics. يعني the way the binder distributes in the granule, طريقة توزيع البايندر في الجرانيول when we do wet granulation is allowing the granules to be compressed in a better way compared to other or compared to the direct compression. So let's talk about each method maybe in little more details. Wet granulation, this is the most widely used method, and as I said, it's widely used because we are producing granules that are free flowing, and because of the binder distribution in the granules. It's widely used method. It involves weighing and blending the ingredients. طبعا before blending them, we need to make sure of the particle size, especially of the drug. After blending, mixing يعني, after blending we need to dam the mass to get wet mass. After wetting the mass by adding a binder solution, we need to break this wet mass by screening the dam mass into granules. Then we need to dry the granules, and then this is very important step, we need to control the size of the granules. We don't want granules, some of them to be big, some of them to be small. So we unify or we allow the granules to be produced within certain size range. طبعا if there is some disintegrating agent to be added, it will be added after sizing the granules, it will be added, and the last step will be adding the lubricating agent, and then the process of compression. Regarding the diluents that we use, lactose is one of the frequently used diluent because it's compatible with almost all drugs. The same is with microcrystalline cellulose. These two are the most commonly used diluents. Lactose is water soluble, microcrystalline cellulose is not. We have also starch, sucrose, dibasic calcium phosphate. So there is a wide range of diluents that we can use. The homework you have is what are the factors affecting which diluent do I need to use. And I will show you these factors. Let me see if it is in this document or maybe another one. No, not this one. So let me see. Okay, choice of tablet fillers. Here it explains to you what are the factors. The choice of filler usually is based on the experience of the manufacturer with the material. يعني if my experience is with lactose, for example, and I have good experience with lactose, I don't want to try something else because it might not be good enough. I have experience with lactose, so I will use lactose. Another factor that affect the choice اللي هو الcost. Another reason اللي هو أو another factor اللي هو compatibility with the other formulation. مثلا على سبيل المثال, for example, I cannot add the dibasic calcium phosphate اللي هو calcium salts. I cannot add it to a tetracycline antibiotic formulation. Why? Because calcium will, في diluent, will interact with the tetracycline, and this will retard or reduce the tetracycline absorption in the GIT. Okay? So you need to answer the question here and submit it by email to me. Okay? طيب, disintegrating agent, these include cross-carmylose, and if you remember, this is a super disintegrant which I can use in tablets. في عندنا corn potato starch, في عندنا sodium starch glycolate, برضو this is a super disintegrant. في عندنا كمان صوديوم كاربوكسيميثايل سيلولوز, وفي عندنا polyvinyl pyrrolidone, في عندنا crosspovidone which is also a super disintegrant. طيب, حكينا, we said this, إنه portion of the disintegrating agent is added at initial blending, and the other half may be added at the end before adding the lubricant. If we do that, we will have what we call double disintegration of tablets. Double disintegration of tablets. يعني, if we add the disintegrating agent in two portions, one in the beginning before making the granules and one after drying the granules and screening it or sizing it, so I will have what we call double disintegration of tablet. What does it mean? Now I will draw this for you. Okay, now if I add it before making granules, then the granules that is formed, this granule will contain ايش? Disintegrating agent. And when I add the other portion after making the granules, then the disintegrating agent will be also in the outside. إذن, if I add it in two portions, disintegrating agent will be inside the granules and outside the granules. So when I want to make tablet, and this tablet is made of granules, and these granules are surrounded by, in addition of course to glidant, etc., it is surrounded by disintegrating agent, and disintegrating agent is also inside these granules. شو بصير عندنا؟ بصير عندنا what we call double disintegration of tablet. يعني the tablet will break easily into fragments, into granules, because there is a disintegrating agent between granules. Okay? So the tablet will break, giving granules, and then granules themselves, they will also disintegrate because they contain ايش? Disintegrating agent inside. فصار عندنا what we call double disintegration. One disintegration of tablet, then disintegration of granules. If I only have the disintegrating agent inside the granules, then I will have only the disintegration of the granules. Okay, yes, the tablet will break because the granules are absorbing gastric juice, and this disintegrating agent will swell or will wick, causing the granules to break. But that is ish one step disintegration. But in double disintegration of tablets, you have the breakup of tablets because of disintegrating agent between the granules, and then the granules will break because of disintegrating agent inside. طيب, preparing the dam mass. Here I need to dissolve, usually in water, is an most liquids that we use to prepare wet mass, they are based on water. So we dissolve, for example, povidone, والpovidone هو polyvinyl pyrrolidone. We we also can prepare cornstarch in a percentage of 10 to 20. We can prepare glucose solution 25 to 50. We can prepare methyl cellulose only 3%, or we can use sodium carboxymethyl cellulose or microcrystalline cellulose. You will notice that some of these names, you have seen them as diluent, you have seen them as disintegrating agent, and here you are seeing them as binder. زي الكورن starch مثلا. This is diluent, binder, disintegrating agent. Microcrystalline cellulose, it helps disintegration as well, and it's a diluent. طيب. You will notice that we are using different percentage, and these are related لإيش? To the power of the binder. If the binder is powerful to bind the particles, then I need to use only small percentage. If it is not so powerful, then I need to use large percentage, as the case with glucose solution. طيب, now what happens if I want to use the wet granulation method to produce granules, but the problem is water might degrade some drugs. So in this case I have options: either to substitute water with non-aqueous liquid, or let's say with alcohol, for example, or I will go for the direct compression or the slugging method or roller compaction method, the dry granulation, to produce the granules. طيب, when we do, or when we intend to prepare the wet mass or the damp mass, you need to be careful from overwetting or underwetting. Overwetting يعني I'm adding more of the binder solution. Underwetting يعني I'm adding little of the binder solution. طيب, what will happen if I am doing overwetting? بصير عندنا الماss is overwetted. After I wet my mass, and I'm doing overwetting here, and then I want to produce or screen the granules or the wet mass. The wet mass will form threads, يعني بصير ينزل على شكل threads instead of coming down as granules. They will come as threads. I don't know if you can imagine the minced meat. When you want to grind the meat and mince it using the machine, you will see that the machine, with the auger inside the machine, is forcing the meat that come out as threads. يجوا مثلا واحد بده يسوي for example لحم ناعم للكباب or etc. They come out as threads. فإذا if I am overwetting شو بصير عنا؟ بصير عنا difficult to granulate because they come out from the screen as threads, وهاي الثreads difficult to break. If I am doing underwetting يعني I'm adding little, معناته there will not be enough binding between the particles, and the particles will come with little granules formed, and even the granules that are formed will break easily, will crumble easily, will be fragile or brittle. فإذا I should not do overwetting or underwetting. There is what we call granulation endpoint. يعني because we don't want to do overwetting or underwetting, we must stop at certain point. High point usually is known by the experienced in the field. طيب, after you produce the wet mass, you want to do what you see here, اللي هو the granulation step, screening the damp mass into pellets or granules. We can do that by hand, يعني we force the wet mass through a sieve, or with special equipment. This special equipment as the one you see in the figure here. Okay? If you look here, we will add the wet mass, and then here we put the tray to receive the granules, and inside this one there is what we call oscillating granulator. يعني bars like what you see here, rotor bars that rotates in both direction, this direction and this direction, to force the moist powder or wet mass, to force it through a screen or sieve. Then here we are fitting a sieve and the wet mass is added, and this will force the wet mass to break through the sieve and down into a tray. إذا هنا بيكون في عندنا إيش؟ a tray. إذا here we have a mesh or a sieve. وهون في عندنا rotor bar inside. We add the wet mass from here, and this will work. So the wet mass will fall down here. طبعا as you see, if we leave the tray like that, the wet mass will form a heap like this. That's why you need to move this tray right and left in order to distribute the granules that fall from here into the whole tray. عشان يكون evenly distributed in the tray. What do you do with this tray? طبعا you take it for drying. One of the most commonly used dryer اللي هو tray dryer. Tray من صينية يعني tray يعني هاي التray. Okay, this is the tray. So you take the tray dryers, there will be several of them, maybe 20 trays or 10 trays, and you'll put them in a tray dryer. Okay, I will show you in a video how the oscillating granulator works, so that you get an idea of how granulation is done. You can see his hand beneath the mesh, just for you to know. Yeah. Okay, after you dry your granules, you take them out, you take the trays out, and this is very important step. You need to control the size of the granules. Usually we need the size to be from 0.85 millimeter to 2 millimeter. However, the size of the granule is related to the size of the tablet. If you have a big tablet, usually the granules are larger. If you have a smaller tablet, usually the granules are smaller. Why we need to size the granules? We already did that before we dried the granules, صح? After we get the wet granules, how do we get them? By sieving them. Now why you need to do sizing again? طبعا the granules that you get as wet here, they may stick to each other. Some of them might shrink. So there will be different sizes of granules. That's why you need to control the sizes. Okay? And the more uniform the granules, the better. So you need to control the size range of the granules so that no segregation can happen between them, and the granules flow will be better. After you size your granules, you need to add the rest of the disintegrating agent if you want to use two portions, one in the beginning, one in the end. And the last thing is adding lubrication. Now lubricants, as already explained, may be glidant, which improve the flow, and this طبعا improving the flow will allow the formulation اللي في الهوبر, okay, because you take the formulation to the hopper. من الهوبر بروح وين؟ Where does it go from the hopper to the hopper shoe? من الهوبر shoe وين بده يروح؟ It will go to the die cavity. فإن order for the formulation to flow easily into die cavity, you need your formulation to have excellent flow. That's why you will need to add glidant. Also, in addition to glidant, you will add lubricants and anti-adherents to prevent the tablet formulation from sticking to the punches. في عندكم lower punch و upper punch that will compress the granules. If they stick to the punches, then you will have tablet with rough surface, pitted surfaces. Also, you don't want the tablet inside the die cavity to stick to the wall of the die cavity. فإذا في عندنا sticking to the wall of the die cavity, في عندنا sticking to the punches. I like to call it picking. Okay, I like to call sticking to the punches picking. We sticking to the die wall sticking, just to differentiate between the two. But you can use both terms. So the lubricants, they are supposed to reduce the friction between the tablet and the punches and the die wall, and the good thing is that they give sheen, لمعان أو smoothness to the finished tablet. As I said, lubricants are dusted over through a fine mesh screen على الgranules. As I said before, we don't really want to have a uniform mixture of lubricant with the granules. Don't forget that lubricants are added in very small quantity, usually less than 1%. Okay? وبتعرفوا when you mix something very small with something very large, you need geometric dilution to have uniform mixture. We don't do this. We don't really need to have uniform mixture in this case. Among the commonly used diluent, we have magnesium stearate, calcium stearate, stearic acid, talc, sodium stearyl fumarate. Remember, this one is hydrophilic lubricant. If you go back to capsules, you will see this name. في الwet granulation, in the topic powders and granules, we also talked about fluid bed process. And I believe you remember the video that I showed you where your powder is loaded في conical part of the fluidized bed machine, and the air comes from below. It agitates the powder. So what will happen? It will get mixed. بعدين you'll spray the binder solution. After that, after you complete this process, you dry your granules here while they are fluidized. Okay? You see here a big fluidized bed granulator with a man standing here to see the difference in size between this man and this big machine. طبعا there is also a small machine that you can put in the lab, a benchtop granulator. Okay. طيب, dry granulation. This method is especially suitable متى؟ Dry. يعني you don't add liquid. When your drug is sensitive to water and sensitive to heat. يعني in these cases, think about dry granulation. In this process, your powder mixture is compacted first, whether through slugging or roller compaction, and then it's broken down and then sized into the granules. And it's very important here that the particles that you deal with, or the powder mixture that you deal with, should compact when you apply pressure to them. If they don't compact, معناته it will be difficult to prepare granules by this method. طبعا you remember in the topic powders and granules, that we have two ways to prepare granules by dry granulation, اللي هو slugging. في slugging, as I said previously, you produce large flat tablets. These can have a diameter of 1 inch. 1 inch يعني how many centimeters? يعني 2.5 centimeters. And it will be thick. Thick, it can be 1.5 centimeter. يعني they are not to be swallowed. After that, you take slugs, you break them with a mill, and then you screen them to control the size of the granules. طبعا when after you finish that, you can add the rest of the disintegrating agent, okay, because before slugging or compression you need to add disintegrating agent. If you don't add all the disintegrating agent portion of it, then you can add it after sizing. The last step is to add lubricant, and then you can do the compression as with others. The roller compaction is more used for dry granulation. It's preferred. The reason why it's preferred, it doesn't apply the high pressure to the powders as in the case with slugging. يعني in the case of slugging, you will need a mill. But in case of roller compaction, you may not need a mill. You can actually break it up with your hand or with the machine that do the sizing. طيب, so you follow the same process as described previously. Direct compression. We need here to have a free-flowing material that is also cohesive. Okay, free-flowing, because I told you that in direct compression the main problem is one, the flow. طيب, the other problem is ايش حكينا, compressibility. Granules are better compressed than powders. That's why you need the powder to be free flowing and cohesive. Now, very little drugs are having such characteristics. يعني potassium chloride might have such characteristics. طيب, that's why in many cases we go for directly compressible vehicle. يعني vehicle that can turn the formulation and make the formulation compressible. Now, you cannot use directly compressible vehicle if your drug, the drug you are using, is in large dose. يعني, for example, if my drug is 1 gram and my drug is not directly compressible, then I might need 2 grams of directly compressible vehicle to make the formulation compressible. So the total will be at least 3 grams. Now 3 grams is a very large quantity for a unit dosage form, for a tablet to be swallowed. طيب, if the drug quantity is smaller, like 100 milligram for example, then I can use such vehicles, directly compressible vehicles, including spray-dried lactose, microcrystals of alpha monohydrate lactose, microcrystalline cellulose, اللي هو الأفيسل if you remember, crystalline maltose, dibasic calcium phosphate. Disintegrating agent, like similar to what described previously, include starch, include sodium carboxymethyl starch, cross-linked carboxymethyl cellulose, اللي هو cross-carmylose fibers. وفي عندنا كمان كروس لينك بوليفينايل بيريدون اللي هو كروس بوفيدون. اوكي, هدول سوبر ديزنتجرانتس. لوبريكانتس مغنيسيوم ستيريت اند تالك. جلايدنس اللي هو سيليكون دايوكسيد الكولويدال سيليكا. اوكي. Now we want to talk about the tableting process. Okay, tableting process. Here I'm talking about the tablets prepared by compression. First, I want to introduce you to the main part of the machine that will do the compression of the tablets. Look here, what you see here is the upper punch. Okay, so this will be here at the top of this one, it will be on the top. Okay, what you see here is the die plate or the die, القالب. And what you see here is the die cavity. What you see here is the lower punch. Okay, now I will explain to you the process with a figure, but first let us explain it here. See, when I want to fill a material, this material comes from a hopper shoe. يعني here I will have a hopper shoe, okay, coming from a hopper. It will fill the material in this place. Okay, now if I lower the lower punch more, I can fill more quantity, صح? If I take it up, the quantity that is filled will be less. So how do I control the weight here? I can control it by the lower punch. Then the lower punch will be responsible for controlling the quantity. But the problem is, شو المشكلة? If I want a tablet with, let's say, 500 milligram weight, how can I know that this space is 500 milligram? I cannot know. This is a problem, because what you have here is a volume. So you want a volume that corresponds to the weight you require. You require 500 milligram. So what do I do? What's the solution? What do you think is the solution? Well, the solution is trial and error. يعني first give a certain space, produce some tablets, and then weigh them. If it is 400 milligram, معناته in this case what do you need to do? You need to decrease this one so that you leave more space. Okay, so decrease it a little bit. Try again. If it is 550, what do you need to do? Okay, you need to raise it a little bit until you get your required quantity. For example, as I said, 500 milligram. طيب, after the formulation gets into the die cavity through the hopper shoe, the hopper shoe must leave the place and the upper punch must descend to do the compression. So you will have a tablet formed. إذا هون راح شو يصير عندي? Here what will I have? I will have a tablet formed here. Okay? طيب, now a tablet is formed. What should happen? The tablet must be ejected. So the lower punch must travel upwards to the surface to put the tablet when على surface. When the tablet goes to the surface, what happens? The hopper shoe comes back and ejects, removes the tablet from the surface. When it does that, the lower punch goes down to the previous position to fill another 500 milligram of the powder from the shoe. And then the cycle continues. يعني the shoe goes back, the upper punch goes down, and the compression happens again. Okay, I want you to see this. This is the foot or the shoe of the hopper, where the formulation falls down. As I said, we control the weight here through lowering or raising the lower punch. Okay? طيب, after that, the shoe must leave and the upper punch will descend. If the shoe does not leave, شو بصير? The upper punch comes down and it will break or make a hole in the hopper shoe. And this happened actually while I was doing my PhD. We had a nice tableting machine in the lab, and because there was a mistake made by the operator, the shoe did not leave the place. طبعا the shoe must leave automatically. في هناك automatic way that the upper punch descends only when the shoe leaves. By automatic way, you will see that in a video. So the upper punch descends, compaction and compression happens, the lower punch goes up to put the tablet at the surface. شوفوا, this one should not go up more. If it goes up more, يعني لو lower punch goes above the surface here higher, شو بصير? When the hopper shoe comes back, it will hit the lower punch, it will hit it. So we don't want this to happen. We want the hopper only to remove the tablet without touching the lower punch. طيب إذن which one is responsible for the compression? اللي هو ال upper punch. Which one is responsible for the weight that is filled inside? اللي هو lower punch. Which one is responsible for the ejection? Lower punch. That's why ejection screw, يعني for the lower punch to travel exactly to the surface, is controlled in the lower punch screw. The capacity to be filled inside the die cavity is also controlled by the lower punch screw. أما the upper punch, with this one we can control how much the upper punch goes inside. وبالتالي, what is the pressure that goes into the granules. Okay. طبعا what I described for you, this is mainly for single punch tableting machine. Single punch tableting machine or tablet press. In industry we have another type of machine. Why? Because this machine, single punch or single station tableting machine, will not be able to produce large number of tablets as required in industrial scale. We can use it in a small scale. Actually, if you go to the pharmaceutical technology lab that we have, you will find the single punch tableting machine from the company Erwica. It's a very excellent machine, and inshallah you will use it in pharmaceutical technology lab in your third year, second semester. In industrial scale, what you have is rotary tablet machine or rotary tablet press or concentric tablet machine. And you have seen this tablet machine when we were talking about multiply compressed tablets, سواء multiple layer tablets or tablet within tablet. You have seen this machine. It consists of several stations of punches. يعني it's not just a pair of punches, one upper, one lower. لا, we have several punches, upper punches, okay, and lower punches. And in between here, we have die cavities. Now this is available, or it rotates while in process. يعني while compression is happening, all the settings are rotating with each other. يعني an upper punch with lower punch with die cavity, okay, they rotate. That's why they call it rotary. They rotate all the time. طيب, initially, what happens? The lower punch goes down, the powder or the granules fill the die cavity. بعدين, after that, the upper punch descends and the lower punch also rises. Okay, the single punch tableting machine, only the upper punch descends. Here we have both punches for rotary tablet machine, that is upper punch descends and lower punch ascends or rises to do the compression step. And then the upper punch will go up, the lower punch will eject the tablet to the surface, and then the tablets get removed. These rotary tablet machines are able to produce so many tablets every hour, and there is even faster rotary tablet machine that is double rotary tablet press. For rotary tablet machine, you have one hopper, okay, one hopper with a feeding shoe and sets of dies and punches, okay. Be double rotary tablet press, you have two hoppers, okay, in the same rotation. يعني you have, for example, here a hopper shoe, you have hopper shoe here, and after the tablets, after the die cavity gets filled and compressed and ejected, then you have another hopper before the dies and punches complete the full circle. Reason I have here another hopper. Okay, so in one full circle, how many tablets get produced? Two tablets. One from the first hopper after filling the die cavity, compression and ejection, and then the same die cavity, the same one, gets filled again by the second hopper after half circle, and then it gets compressed and then ejected. فإذا في عندنا two tablets are produced from each die cavity in each circle. Okay, see, it can produce in 1 minute, يعني 60 seconds, you can produce in such machine, you can produce 10,000 or more tablets per minute. Here you will see the diagram of rotary tablet machine. Okay, you will see here the feeder, اللي هو الهوبر shoe. Okay, here you have the upper punches, here you have the lower punches. The lower punches will descend. طبعا this is to control the weight of the tablet. Okay, so you can control the weight by lowering or rising or raising the lower punches, little up or little down. So it will control the space here. So from the hopper shoe, the die cavities get filled. After that, see, the lower punch descends more, and then when the upper punch gets inside, the lower punch goes up in what we call pre-compression step. شوف في عندنا هنا pre-compression roll. The reason for this pre-compression roll is to remove any air inside. The presence of air inside can cause problem to the tablets. The pre-compression roll will remove and will consolidate the powder, and then I have the main compression where the upper and lower punches they compress harder. طيب, this happens very quickly while the upper and lower punches and the die cavity are rotating. يعني this happens while this is continuously rotating. Okay, while it's rotating, as I said, the lower punch gets down to be filled with powder formulation or granule formulation, and then it gets pre-compressed and then compressed. طبعا, as I said, this happens very quickly, and the reason why we need pre-compression is to remove, as I said, air, but also to allow more time for the granules or powder inside to be compressed. Now the problem, one of the problem of being very fast in producing the tablet is that there is no sufficient time for the granule or the powder to adhere to each other and get compacted properly. This is one of the problems. That's why even if my tableting machine can produce more than 10,000 tablets per minute, I don't want to go high in speed, because the higher the speed that I use, the more problem I will get with the tablet, and you will see this later. Also, it tells you that because of the speed of filling and rotation, it tells you that the powder here must get inside the die cavity very quickly, and this can only happen if you have excellent flowing powder. That's why in some machines they fit what we call induced die feeder. شو يعني induced die feeder؟ نعرف شو die feeder. This one feeds the die cavities. Okay. Induced معناته يحث, enhance, improve die feeding process. So in some machines they can fit agitator, as you see here. This is a motor to agitate the powder وين بالفeeding frame. هذا الفeeding frame اللي هو الشو تاع الهوبر. So you want to fill the powder inside the die cavity here, okay? In order for this to happen very quickly, you need to agitate the powder in the hopper shoe. Otherwise, not enough powder gets in, and if there is not enough powder because of high speed or because of bad flow, then less powder will get inside, and you will have problem with the weight of the tablet, with the mechanical strength of the tablet, etc. I will talk about these problems, but first, let us go back to the single station tablet machine, the one that you see here, okay, and see in a video how such machine can produce tablet. Please watch the video. Okay, what you see here, you see the hopper shoe. This is the hopper here, and this is the hopper shoe. And you see the upper punch descending when the hopper shoe leaves the place, okay? Later on, you will see also the lower punch and how the process is adjusted to produce tablets.
Similar adjustments for ejection height, fill depth, and pressure setting as TDP-1 and TDP models. There's also a similar flywheel for manual control, and as well as a feeder hopper to deliver the formulated powders to the feeder shoe. There's a special tool designed to dejam the machine and an on-off button for machine power. This is a close-up of the lower drift pin assembly. This is the ejection height control, and this is the knob for the fill depth control. This is a close-up of the upper drift pin and the area where you adjust the pressure for the upper punch. This is a side view of the TDP-5. You have a better view of the on-off control box and a view of the motor, heavy-duty motor that we put on these machines. It is possible to produce a tablet on the TDP-5 manually by spinning the flywheel around. The TDP-5 has a maximum fill depth capacity of 16 millimeters, and this machine will run continuous for hours.
okay, I will show you also the rotary tablet press. Okay, you see here one of them. You see this is the hopper, and these are the upper punches and these are the lower punches. We'll see this in a video now. These are the lower punches, and you have seen the upper punches. This is the pre-compression. And this is the final compression, you will see. Okay, what you see here, when the machine does the compression, they use sensors في الpunches to sense how much compression was applied. طبعا the compression, as you have seen in the previous demonstration, the compression can be regulated by the upper punch in single punch machine and by the upper and lower punches in the rotary tablet machine. Now, the problem is when we adjust, when we want to adjust the pressure, we adjust it indirectly by adjusting how much the upper and lower punch will get inside the die cavity. So if we regulate the upper punch and lower punch to go more inside the die cavity, this will cause higher pressure. If we adjust them to with lowering their distance they travel inside the die cavities, then we will have lower pressure, right? But if you don't have good filling inside the die cavity, what will happen? Let's say the die cavity should be filled completely, right? Now, if a partial or half of the die cavity is filled, then the compression will not be strong enough, right? Because when you adjusted the punches to travel inside, you adjusted it based on what? Based on full filling. If the die cavity is not completely filled, this will cause the compression to be weaker. طيب. And the tablet weight will be less كمان than what you expect. So you can monitor this in the diagram that you see here. If it shows lower compression force than expected, it means you have less filling and you are having problem probably with the speed at which the rotation of die cavities happen. There is no enough time for complete filling, or maybe the powder flow is getting worse and you have problem with the powder flowability. فإذا you can actually find out what will happen to the tablet weight just by watching the compression force. إذا the compression force can indirectly tell you about the tablet weight. The higher the compression force you get, it means that there is more powder inside. The lower compression force means there is less powder inside the die cavity. You see here the filling of the die cavities. compression, then ejection, compression, ejection. And you will see here a tablet deduster. We need to remove dust. Similar to the case with capsules, we need to remove dust from tablets because these dusts can cause contamination, can cause other problems. Okay, what I want also to show you, I want to show you this diagram as animation while it's moving so that you understand the process better. Okay, I hope now you understand how tablet machine works. Now we will talk about some problems that you might see in the tablet, and particularly I will talk about the horizontal striation that you might see in the tablet, such as this one. So after producing the tablet, you might see this one, okay, striation, تشقق يعني horizontal. You might see it in the body of the tablet as you see here, or you might see it in the top part, يعني here, where the curve happens, starts, or at the bottom where also the curve starts. You have curve here. In case the striation or cleavage or تشقق happens at the top or bottom part, we call it capping. نحكي للمشكلة هاي capping of tablets. Capping of tablets. إذا كان التشقق, if the cleavage or striation happens in the body as you see here, between here and here, you see this horizontal cleavage, then we call it lamination. Now, this you may see this when you inspect the tablet, you might see it. Sometimes you don't see it readily. There is a problem in the tablet and there is weak bond between the parts of the tablet, but you are looking at the tablet, looks fine. There is a test that we will talk about it in quality control tests according to the pharmacopoeia. When you do that test, if there is such problem that is not visible initially after producing the tablets, you will see it while doing that test. Even though that test is not for this purpose. يعني التست هذاك that I will talk about it later for quality control is not to detect this problem, but if this problem exists but you cannot see it still, the tablet will break while you are doing that test, and you will see that there is a problem of striation, lamination or capping. Now, what is the reason for lamination or capping? The reason for lamination or capping is, one, there is no enough time for bond to happen during compression. As I told you, even if your machine, tableting machine, is capable of producing very, very high number of tablets per minute, still you don't need to use the highest speed. You need to use appropriate speed, because if you use high speed, this means that everything will happen very quickly, even including the compression step. The compression step is not dependent only on the force that is applied. مش فقط أنا, for example, I want stronger force so I will have better bond. لا. It also depends on the dwelling time of punches. يعني how much the punches stay inside the die cavity. The longer they stay compressing the powder, the better, because this means you will have better adhesion of the formulation. فإذا this is one problem. Another problem is air entrapment. Also, if you do the filling of the die cavities very quickly, you might have air. And this is one reason why we have a pre-compression step, to remove any extra air that might be inside. The presence of air will cause a problem of lamination or capping. Keith, when the punches compress the formulation inside the die cavity and there is air inside, air will also get compressed inside the formulation, forming a layer inside the tablet, air layer جوا الtablet. Now, when you release the pressure by the upper punch ascending and the lower punch descending, this air wants to expand layer تاع الاير اللي inside the tablet. When it wants to expand, شو بصير؟ It will break the tablet horizontally and result in lamination or capping. Also, if you are using immaculate, not clean and not smooth punches, this will cause the formulation to stick to the punches because they are not clean. And while the punches are departing from each other, lower والupper بيبتعدوا عن بعض, departing from each other, they may weaken the tablet. ليش? Because the tablet surfaces, they want to adhere to the punches. While the punches are departing from each other, this might cause the tablet to break. Also, too much fines in the formulation will prevent good adhesion in the powder formulation. That's why we need to control how much fines in the formulation. Now, the presence of fines is very important in the formulation, but too much fine is very bad. Usually maybe up to 5% of fines is okay. More than that, then you might be having a problem of capping or lamination. Also, during storage, especially if it was improper storage, the material inside the tablet, like for example the drug, for example, might start changing in its form. يعني مثلا I'm using amorphous drug, and you took this in physical pharmacy 1. With time, it might change to crystalline in the tablet because of improper storage. This change will cause also lamination or capping. Sometimes even with time, the material that is stuck with each other by forming a tablet, this material was prepared under compression. This material, if it is elastic material, يعني مطاطي, for example, you have some material that if you press on them, they change in shape, but slowly they will come back to their original shape. So if there is elasticity in the formulation, with time they may break again from each other to retain their original shape, and this will cause also lamination or capping, as you see here. This is lamination. This is after the tablets are the tablet parts, upper part and lower part, is removed from each other. So you see how the rough surfaces are. طيب, because you know the reasons for lamination and capping, you will be able to tell us what are the solutions. يعني إذا عرف السبب عرف الحل كمان. طيب, after you produce the tablets and you inspect them for weight, etc., you need to do tablet dedusting. And this is like a hoovering machine. شوفوا هنا موصل على الهوفر that sucks the dusts from the tablet. One of the problems that we need to deal with in industry اللي هي what we call cross-contamination. Cross-contamination is that after I produce tablets, like for example Panadol, I need to clean everything, so no dust from paracetamol will be in the area where tablets are produced. So dusts are there, and you need to remove them because later on you will do packaging, and you don't want dust to be around the tablets. When I say dust, I don't mean sand, I mean tablets particles, the particles of the formulation. Okay? Inshallah, in part 2, I will be talking about tablet coating. I hope that you gained a good understanding so far of what was explained. If you have any question, please do not hesitate to contact me, whether this is by email or by WhatsApp, in the WhatsApp group. I will be ready and happy to answer you. Ma'as salam.